Chickenpox is an illness caused by the varicella-zoster virus. It brings on an itchy rash with small fluid-filled blisters. Chickenpox spreads very easily to people who haven't had the disease or haven't gotten the chickenpox vaccine. Chickenpox used to be a widespread problem, but today the vaccine protects children from it. The chickenpox vaccine is a safe way to prevent this illness and other health problems that can happen during it. The symptoms. The rash caused by chickenpox appears 10 to 21 days after you are exposed to the varicella-zoster virus. The rash often lasts about 5 to 10 days. Other symptoms that may appear 1 to 2 days before the rash include fever, loss of appetite, headache, and tiredness and a general feeling of being unwell. Once the chickenpox rash appears, it goes through 3 phases, beginning with raised bumps called papules, which break out over a few days, followed by small fluid-filled blisters called vesicles, which form in about 1 day and then break and leak. Then finally followed by crusts and scabs, which cover the broken blisters and take a few more days to heal. New bumps keep showing up for several days, so you may have bumps, blisters and scabs at the same time. You can spread the virus to other people for up to 48 hours before the rash appears. The virus stays contagious until all broken blisters have crusted over. The disease is by and large mild in healthy children, but sometimes the rash can cover the whole body. Blisters may form in the throat and eyes. They may also form in the tissue that lines the inside of the urethra, anus and vagina. When to see a doctor. If you think you or your child have chickenpox, call your healthcare provider. Often, chickenpox can be diagnosed with an exam of the rash and other symptoms. You may need medicines that can help fight off the virus or treat other health problems that can happen because of the chickenpox. To avoid infecting others in the waiting room, call ahead for an appointment. Mention that you think you or your child may have chickenpox. Also, let your provider know if the rash spreads to one or both eyes. If the rash gets very warm or tender, this might be a sign that the skin is infected with bacteria. If you have more serious symptoms along with the rash, watch for dizziness, new confusion, fast heartbeat, shortness of breath, shakiness, loss of the ability to use muscles together, a cough that becomes worse, vomiting, stiff neck, or a fever higher than 102 Fahrenheit or 38.9 degrees Celsius. If you live with people who've never had a chickenpox or haven't gotten the chickenpox vaccine yet, if someone in your household is pregnant, and if you live with someone who has a disease or takes medicines that affect the immune system. The causes of chickenpox. A virus called varicella-zoster causes chickenpox. It can spread through direct contact with the rash. It can also spread when a person with chickenpox coughs or sneezes and you breathe in the air droplets. The risk factors. Your risk of getting infected with the virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had a chickenpox vaccine. It's extra important for people who work in childcare or school settings get vaccinated. Most people who have had chickenpox or have gotten the vaccine are immune to chickenpox. If you've been vaccinated and still get chickenpox, symptoms are often milder. You may have fewer blisters. A few people can get chickenpox more than once, but this is rare. The complications. Chickenpox is often a mild disease, but it can be serious and can lead to other health problems including infected skin, soft tissues, bones, joints or bloodstream caused by bacteria, dehydration when the body runs too low on water and other fluids, pneumonia, an illness in one or both lungs, swelling of the brain called encephalitis, toxic shock syndrome, a dangerous complication of some illnesses caused by bacteria, and Ray's syndrome, a disease caused by swelling in the brain and liver. This can happen in children and teens who are taking aspirin during chickenpox. In rare cases, chickenpox can lead to death. People who are at higher risk of chickenpox complications include newborns and infants whose mother never had chickenpox or the vaccine. This includes children under age 1 who have not yet had the vaccine, teens and adults, pregnant women who haven't had chickenpox, people who smoke, people with cancer or HIV who are taking medications that can affect the immune system, and people with a chronic condition such as asthma who take medicine that calms immune response, or those who have had an organ transplant and take medicine to limit the immune system's action. Chickenpox and pregnancy. Low birth weight and limb problems are common in babies born to women who are infected with chickenpox early in their pregnancies. When a pregnant person catches chickenpox in the first week before birth or within a couple of days after giving birth, the baby has a higher risk of getting a life-threatening infection. If you are pregnant and not immune to chickenpox, talk to your healthcare provider about these risks. Chickenpox and shingles. If you've had chickenpox, you are at a risk of a complication called shingles. The varicella-zoster virus stays in your nerve cells after the chickenpox rash goes away. Many years later, the virus can turn back on and cause shingles, a painful cluster of blisters. The virus is more likely to come back in older adults and people with weaker immune systems. The pain of shingles can last for a long time after the blisters go away, and it can be serious. Now, to the most important part of this video, the prevention. The chickenpox vaccine, also called the varicella vaccine, is the best way to prevent chickenpox. Do not get the chickenpox vaccine if you are pregnant. If you decide to get vaccinated before pregnancy, don't try to get pregnant during the series of shots or for 1 month after the last dose of the vaccine. Check with your healthcare provider about whether you should get the vaccine if you have a weaker immune system. This includes people who have HIV or take medicine that have an effect on the immune system. If you are allergic to gelatin or the antibiotic neomycin. If you have any kind of cancer or are getting cancer treatment with radiation or medicines. And if recently you received blood from a donor or other blood products. Talk to your provider if you are not sure whether you need a vaccine. That's it. Thank you very much for being with me to the end of this video. Drop your questions and your concerns in the comment section and I'll respond to it accordingly. Subscribe to my channel if you haven't, and forward my video to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference, and don't forget, Kofi loves you. Peace out.